Hey everybody, how y'all doing? It's Steve coming at you. Hope you're having a great day. I just wanted to discuss a couple of things really quickly because I've been on social media, mainly on Facebook, and people have been clowning on me because of my take on this whole coronavirus issue. So I want to make some things really clear. And first of all, I'm going to say this. I have some friends I care for very much who work in the medical field, and they are very concerned, as they should be. And I want them to know how much I appreciate them, and also how much I appreciate anyone who works in the medical profession and who's having to deal with this on the front lines, especially in the hospitals. So I want to make sure that's clear, first and foremost. Now, with that being said, I want to get to my next point. Just because I say that the hysteria around the coronavirus is unwarranted does not equate to me thinking the coronavirus is a hoax. I don't know how people get that twisted in their minds, but somehow they do. And all I've said is the hysteria is unwarranted and unnecessary, because the hysteria leads to panic, or leads to fear rather. The fear leads to panic. The panic leads to overcrowded hospitals and the issues that people in the medical profession are having right now. So I'm not saying that this isn't a big deal. I'm not saying that it's not serious. What I am saying is that based on the research I've done, the hysteria for it is not warranted. Here's a great example. And I know I'm going to hear, oh, but Steve, it's not like the flu. Okay, before we get there, let me go with this first. I looked up some statistics, and here's something really interesting. As of this year, March 14th, 38 million people in the U.S. alone, these are only U.S. numbers, 38 million people had the flu. 390,000 of them had to be hospitalized. 23,000 died from regular flu, rather it be H1N1 flu or Victoria virus. H1N1 virus and the Victoria virus. That included a lot of young people that died. Especially, I think in that week alone, there was a report of 149 children who had died from flu-related illnesses. Okay? That's the flu. We're now over 1,300 people with the coronavirus, or up to 90-some thousand who've been diagnosed with it. 1,300 deaths. Remember those numbers. 1,300 deaths total since the start of this thing. You know, the first time it was reported by China was in December. We closed our travel with China in January. The president put together a task force in January, and we've been working on this ever since January. So from January on, let's just look at those numbers. 1,300 people have died from the coronavirus. The numbers I gave you initially for the flu were from the week of March 14th. 1 week later, for the week of March 21st, 39 million people have been diagnosed with the flu. That's 1 million more than the prior week. 1 million more people diagnosed with the flu. Okay? 400,000 of them had to be hospitalized. That was 10,000 people that had to be hospitalized in 1 week's time. And 24,000 died. That's 1,000 people in 1 week that died from the flu or complications related to flu. And that's something I point out, another point I want to touch upon. When you're hearing a lot in the news, especially when they're not telling you, they're talking about these death tolls, what they're not telling you is the average age of the person who's dying from the coronavirus, or necessarily whether or not they had other mitigating circumstances like other health issues, immunodeficiency issues. All you're hearing about is here's the number dead. Okay? They're not telling you it's complications from coronavirus or COVID-19, which the disease is called. They're saying they died from this. It could have been some other issue they had that was exacerbated by the disease, and they couldn't fight it off. By when they able to fight it off, that's how they died. So, of course, the disease COVID-19 definitely helped contribute to it. But you don't hear that. All you're hearing is, this is how many people have it, this is how many people are dead in the U.S. And the large majority of the deaths and the cases are in about 4 or 5 states of all the states involved. So when are we going to stop with the hysteria? Because I just told you 1 million more people were diagnosed with the flu. 10,000 more of them had to be hospitalized because of it in 1 week. And 1,000 of them died in 1 week's time. Haven't heard boo about it in the media. But the hysteria behind COVID-19, because we don't understand that much about it. So the flu, we know about. The flu happens every year. Tens of thousands of people die every year from the flu. We know about it. Oh, and by the way, the flu we have vaccines for, and yet we still lose tens of thousands of people every year. The issue with COVID-19 is we don't know. And so what we don't know, we tend to fear. And the media is driving the hype train behind this hysteria, and our fear leads to us doing things that cause us to panic. That panic causes people to buy way too much toilet paper when they don't need it, and we end up having to run on toilet paper. I don't know why, considering COVID-19 is a respiratory disease. I don't know why they figure they need to cover their butts when they have respiratory issues, but whatever. I digress. Run on all kinds of other things in stores for no real reason. These are perfectly healthy people. The hysteria leads to people like the couple in Arizona who decided to put, even though the president talked about hydroxychloroquine, they decided to put chloroquine phosphate, a completely different chemical, in their sodas and drink it, and now the husband's dead and the wife is in ICU saying, oh, don't believe anything the president says. Well, the president didn't tell you to drink chloroquine phosphate, stupid. This is what I'm talking about. It's all hype. It's all this hype train that's, I personally believe, is more dangerous than the virus. It's the hype train that's caused us to have to shut down almost every store in the country. Churches you can't go to. Sporting events you can't go to. And they were able to do all of that with the fear that you might catch a germ. I'm just saying, something about that doesn't sound right to me. And I'm sure I'm going to hear, Steve, you don't understand, it's much more deadly than the flu. Do we really know that? See, the preliminary numbers will show that, because remember initially they were saying, oh my gosh, it can get to kill 4, 5, 6% of the population. Guess what? We're down to 1.4% in the U.S. See, as numbers continue to come in, they also continue to fall. And here's something else that's new. Even though the numbers of cases for the coronavirus have increased, the numbers of people who require hospitalization for it have decreased. That's a good sign. So what I like to see is us stop hyping the hell out of this thing, because the hype is far more dangerous, I believe, than the actual virus. And by the way, if I actually catch the virus, I'm out driving right now. I have some place I need to be, some things I need to do. I gotta go shopping. But I'm out driving right now. If I catch it and I die from it, although I'm a healthy person, there's nothing wrong with my heart, I don't have any respiratory issues. But if I die from it, then it was just my time. Me dying from it doesn't mean that you hyping it was okay. It just means somebody else died from it. Oh, and by the way, we used to have something called, whenever you went to the doctor, and I've had this happen, by the way, whenever you went to the doctor because you were having an issue, hard time breathing, had a headache, or you had a fever, and it wasn't the flu. By the way, this was before COVID-19. I had to go through this last year. they would call it, since they couldn't really diagnose it as being a particular cold or a flu, they would call it an upper respiratory infection. You have an upper respiratory infection. Let me give you these meds. Let me give you, or you have you have some type of respiratory virus. Let me give you this meds. Give you these inhalers. Hope you make it easier for you to breathe. Send you on your way. I don't remember anything closing down when they couldn't diagnose a respiratory issue. That made it hard for me to breathe. So again, let's calm down. I'm not saying it's not real. I'm not saying you shouldn't be worried about your loved ones who have immunodeficiency issues. You should be worried about them when it's flu season. You should be worried about them when it's cold. You should be worried about any little thing they can catch that would compromise their already compromised immune system. It shouldn't just be COVID-19 and that's the only time you're worried about these people that you love and care for. The hype train is what's driving all the issues, and I'm gonna say most of the issues that we're running into right now. It's time to stop the hype, calm down. You don't need 82,000 rolls of toilet paper. It's gonna be okay. And if something happens and you go, then it was your time. And if something happens and I go, then it was my time. Because when it comes right down to this. If that's the way it goes down, something was going to get me. I'm driving right now. I'm more likely to get killed driving this car than I am to get killed by the virus. But I don't stop driving. You're more likely to die in your sleep, by the way, especially when you reach a certain age. More elderly Americans, you're more likely to die in your sleep than you are to die in a plane, but you're not afraid to go to bed, are you? So let's calm it down, people. I mean, come on, calm it down. It's gonna be okay. Don't let the media hype. Stop watching the news. I love Fox, and I had to stop watching. Stop watching the news. Whatever news you watch, especially if you watch MSNBC and CNN, stop watching all that BS. Stop watching the news. Go find some cool movies to watch with your family, or go out and find something cool to do with your family that you can be away from other people. Take a little walk, take your dog for a walk, whatever. But stop buying into this hype. If we're all calmed down, we could calm down the stress on the emergency services, which will make this easier for them to diagnose and find and get through this process. And with that, I hope you're having a great day. Y'all take care. Come at me. I'm sure I'm going to have people who say, Steve, you just don't know what you're talking about. Blah, 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 blah. Whatever. I get it. But this thing is more deadly than the flu. The numbers aren't bearing that out in the U.S. right now. The numbers just aren't bearing that out. And I looked at stuff for flu season this year, or actually between late 2019 and now, flu season. The numbers just aren't showing that right now. Now, I'm sure there are plenty of reasons for it, but again, you're looking at preliminary numbers that you have for COVID-19. You're not even considering the number of asymptomatic people who have it and just don't know and they're walking around having it, who survive, because we don't know that number. You see what I'm saying? So how do we know how true your numbers actually are? Let's just ride this thing out. Let's do the things they ask us to do right now, but let's get the country opened up again, because I don't ever remember a flu-like or pneumonia-like virus capturing this kind of control of the economy ever before. Let's change this thing up a little bit, guys. Let's change the way we do things, and let's be smarter. I hope y'all having a great day. Y'all take care. If you like what you heard, please subscribe. Hit the like button. Hit the notification bell so you get notifications when I'm on. If you don't like it, by all means, hit the down vote as well. Leave a comment. Leave comments. Tell me why, all the reasons why you think I'm out of my mind. I'm okay with that. So I look forward to hearing from y'all. Y'all take care. Hope you have a great weekend. Bye-bye.